Do you have any idea how much of your hard-earned Social Security check is about to be eaten up by Medicare costs in 2026? Listen to me, because this is the money that belongs to you, and if you don't understand these numbers, you are going to be in for a very rude awakening come January 1st. You've worked your whole life, you've saved, and now you're at a point where every single dollar counts. But the government has just released the new figures for 2026, and I need you to stand up and take notice. The biggest fear I hear from all of you, my retirees, my people about to cross that finish line, is that your healthcare costs will spiral out of control and leave you with nothing. And I'm here to tell you, if you don't plan for these specific increases, that fear could become your reality. We are looking at premiums and deductibles that are moving up, and you need to know exactly what is coming out of your pocket. Let's start with Medicare Part B. This is your medical insurance, your doctors, your outpatient care. For 2026, the standard monthly premium is jumping to $202.90. That is an increase of nearly $18 from last year. Now, for many of you, that premium is deducted right from your Social Security check. You might think, Susie, it's only $18, but when you add that up over a year, that's over $200 of your annual income gone. And it's not just the premium. The Part B deductible, the amount you have to pay before Medicare even starts to help you, is rising to $283. But here is where it gets dangerous. If you are a high-income earner, or if you had a particularly good year 2 years ago, because remember, Medicare looks at your tax returns from 2 years prior, you might be hit with what we call IRMAA. That's the income-related monthly adjustment amount. If your modified adjusted gross income in 2024 was over $109,000 as an individual or $218,000 as a married couple, your Part B premium isn't $202. It could be $284, $405, or even as high as $689 per month. You have to check your tax brackets, because if you cross that line by even $1, your premiums skyrocket. Now, let's talk about Part A, your hospital insurance. Most of you get this for free because you paid into the system for 40 quarters. But free only refers to the premium. If you have to go into the hospital in 2026, the deductible you pay for each benefit period is $1,736. That is a $60 increase. Think about that. If you are admitted to the hospital, you are out over $1,700 before the first day is even covered. And if you stay longer than 60 days, you're looking at $434 per day in coinsurance. These are not small numbers, people. This is why you must have a plan. I also want to talk about the one piece of good news, and it is a big one, hidden in the 2026 changes. This is regarding your prescription drugs, Part D. Thanks to the Inflation Reduction Act, there is now a hard cap on what you pay out of pocket for covered drugs. In 2026, that cap is $2,100. Once you spend $2,100 on your prescriptions, you are done for the year. No more donut hole, no more endless copays. For those of you on expensive maintenance medications, this is a lifesaver. However, keep in mind that the maximum deductible a Part D plan can charge you is also moving up to $615. So, what is the actionable takeaway here? What do you need to do right now to protect your retirement? First, you must review your 2024 tax returns. That is the year Medicare is looking at to determine your 2026 premiums. If you see that your income was higher than usual, maybe you sold a house or took a large distribution, you need to prepare for those higher IRMAA costs. If your circumstances have changed since then, maybe you retired or lost a spouse, you can actually file an appeal to lower those premiums. Don't just sit there and pay it. Second, you need to look at your Medigap or Medicare Advantage plans. If you are on original Medicare, that $1,736 hospital deductible is a massive risk. Do you have a supplemental policy to cover it? If you are on Medicare Advantage, the average premium is actually staying relatively low, around $14 a month, but your out-of-pocket maximums for doctor visits might be changing. You must read your annual notice of change that comes in the mail. Do not throw it in the trash. And finally, you have to automate your savings for these healthcare gaps. If you know your Part B premium is $202 and your deductible is $283, you need to have that cash sitting in a high-yield savings account, ready to go. Do not let a doctor's visit or a trip to the pharmacy put you into debt. Retirement is supposed to be your time of peace, but you cannot have peace if you are constantly worried about how to pay for your health. Knowledge is the ultimate power. Now that you know these 2026 numbers, you can't say you weren't warned. You have to be the master of your own money. You have to stand in your truth and prepare today so that you can enjoy your tomorrow. With that said, thanks for watching and until next time.